Phil Gildenberg, presently in Houston. Took my training at Temple Medical School in Philadelphia, large part of it with Spiegel and Wycis, about whom we're going to talk today. Bill?
I'm Bill Buchheit. I was with Phil as a resident at Temple University and also trained with Dr. Spiegel and Wycis. It was a great occasion, and I think Phil probably knows more about that than anyone around.
Well, it was an experience. As Wycis describes the pair, people referred to them as ham and eggs, and he couldn't figure out which was which.
Well, perhaps people don't know that Henry Wycis weighed about 350 pounds. He was enormously overweight, and Spiegel was just exactly the opposite. You got almost a feeling between the two, they looked like Mutt and Jeff, and two different spectrums of morphology worked together so well.
And two different spectrums of personality.
Oh, yeah.
And Obrador had referred to them as Don Quixote, and Sancho, with Spiegel, of course, being the visionary Don Quixote, but not always practical, and Wycis being his faithful, down-to-earth companion.
I think a very good analysis, because Wycis was down-to-earth and a trained neurosurgeon, and Spiegel was just a extremely bright, intellectual type of guy. As I told you the other day, that Spiegel's best friend was Albert Einstein, and he used to go one afternoon a week to visit with Mr. Einstein. That was the type of company he kept. And I don't think Dr. Wycis, although he was very bright, I don't think he was in the league with Spiegel and Einstein.
Well, I think Wycis's best friends were his poker buddies.
Yeah.
They came from different interesting backgrounds also. Spiegel had graduated from the University of Vienna in 1918, and he became the youngest docent at the university, and was working there with Obersteiner, and apparently creating quite a reputation even at his very young age. And around the late 1920s started to be squeezed by the anti-Semitism in Vienna, and in 1930 was given the opportunity to go to Philadelphia. I have a copy of the letter that was sent to him. The letter is a preliminary agreement between Dr. Ernest Alf Spiegel and Madame Dr. Mona Spiegel Adolf and Temple University Medical School. It's dated June 13th, 1930. Signed by Drs. Spiegel and his wife, Dr. Mona Spiegel Adolf, who also was quite an outstanding scientist, and William Parkinson, who was the dean of Temple Medical School at that time. Actually, he's more than the dean. He was the one-man administration of the medical school for many years. But it starts out by saying, hereby understood that Dr. Spiegel agrees on his part to accept the professorship of experimental and applied neurology at Temple University Medical School at a salary of $5,000 a year, and that Madame Dr. Spiegel Adolf accepts on her part a professorship at the salary of $2,500 a year to be known as the Professor of Physical and Colloidal Chemistry.
But Phil, that was for the Spiegels, $7,500 in the Depression. So that was a very big salary.
Well, not only that, but the agreement also goes on to indicate that they were free to accept honoraria and actually tuition from individual students who would want to study with them outside of the university curriculum. So it was apparently an attractive offer. From what's been said, there was quite a lot of competition to get Spiegel at that time. So that all of the right things were in place for him to go to Philadelphia. He had in Vienna, at that time, he had lost many of his lectures, he had lost his laboratory, and it was obvious that he was going to be squeezed out of the school. He was so bitter about leaving Vienna that he was offered an honorary doctorate in the mid-1970s and refused it. Also, there was the international, the Federation of Neurosurgical Societies, I think, met in Vienna sometime around 1965, I think it was, or thereabouts, and he refused to go just because it was in Vienna. So he was Vienna's loss, but Philadelphia's gain.
But it was interesting to be around because his mind functioned on such a level that it was very difficult to really, as a young resident, to really deal with him. I remember so clearly, Phil, being in the lab one day, in the anatomy lab, and several of us had taken a microtome and cut a, well, it wasn't really a microtome, it was a very thin, very, very thin section of the brainstem. And one of the neurosurgical faculty said, which is cranial and which is caudal? And this very thin, like a wafer, you could hardly tell. And none of us could figure it out to our satisfaction. And someone said, well, let's ask Spiegel. So we went to the lab and took this on a little petri dish, this very thin slice of brainstem, and said, which is cranial, which is caudal? And Spiegel moved his glasses, looked at this, put it right up under his nose, looked at it very carefully for a minute, turned it around, handed it back, and he said, don't bother me with such silly questions.
Well, he was amazing in that he read everything and he remembered everything. And we used to have a game. His contention was that there was nothing new in literature, and there was precedent for anything. So I used to take in the latest copy of whatever journal came by, trying to find an article that was unique. And I'd bring in an article, and he'd look at it, and he'd say, well, in 1932 in Pfluger's archives, there was an article about the same thing. And I'd run over to the library or look up Pfluger's archives, and invariably he was right. Just remembered everything from years later. And when he wrote his manuscripts, a couple of curious things. First is that I don't think he ever used a fresh sheet of paper in his life except for correspondence. But he wrote his manuscripts on the back of the EEG paper from EEGs that had been done, paper bags, the back of advertisements that he'd get junk mail in the mail advertising scientific things. He just turned them around and used the back, and always with a very short, stubby pencil. But he would write in the German shorthand that he had sort of changed around a little bit. And as far as I know, there are only two people who could read that. One was Spiegel, who were in German and English, and the other was his secretary of many years, Ethel Lombard. And he would sit down and write out his manuscripts just almost in final draft, including the references, without having to consult the references.
I talked to Ethel. She still works in the neurology department. As a matter of fact, she's from New Orleans. So I talked to her about coming down here and having this interview with you, and she said she had talked to Spiegel in his latter years, after he had left the university, was home, was retired. She was in his home one night, and she said, Ethel, who's about our age, said, oh, Dr. Spiegel, she said, I hope when I'm your age, my memory's as good as yours. Spiegel said, Ethel, don't worry. Your memory has never been so good as mine.
Right. He was amazing that way. Also, the other thing that was very embarrassing was every once in a while we'd get into a discussion about something, and he would remind me of something I wrote or said years before to refute my own argument, and I wouldn't remember it, but he would remember it.
The curious, though, is his partner, Wycis, was very, very bright. Henry Wycis was first in his class in medical school. I think his grades had never been equal, and for years no one ever got such good grades as Henry got, while he was working full-time, and I think probably playing poker a little bit, and doing some other things he probably shouldn't have been doing.
Well, Wycis was interesting. Wycis came from just the opposite background as Spiegel. Wycis was from a small town in Pennsylvania.
Yeah, Trenton.
And was an athlete as he was growing up, and played semi-pro baseball as a shortstop for a while.
And I think his parents were Polish immigrants.
That's right.
Yeah.
And he went through college, then he went through medical school, but the rumor was that he really never attended class. He just went in to take the exams, and spent his time in Spiegel's lab.
The stories were that Henry Wycis was a potential Major League Baseball player. He was a figure skater for a while. He was a magician. He was a card shark. He was a coin collector. He collected everything. And, you know, his life, all through his life, it was that way. It was just the smartest, the best, and the most maverick of people.
Yeah,
and his work with Spiegel was interesting because intellectually, I think they were kindred spirits. Personally, and the way they lived their life and how they did things was totally different.
Well, Wycis was interesting from another standpoint in that he came from a very poor family, and the word was that he worked his way through medical school playing cards, and was a very successful gambler. One of the card tricks he used to do was to peel off cards and then recite them back in the sequence in which they were peeled off. So he had fantastic memory, and that probably was a big factor in his success in gambling.
On rounds in the hospital, when we were residents, he would go to the bedside and the patient was playing with cards, playing pinochle or one of those other single card games. He would pick the cards up oftentimes, shuffle the deck, and deal cards out to the patient that he would just operate on. And if he didn't do that, he would do a card trick for them and make cards fly this place and that place. He was very interesting about that, and he had a bear trap memory about his patients too, because he could. I remember going into a room with him, and he had seen a patient. She said, "Oh, Dr. Wycis, you operated on me so many years before, and this stuff and that stuff." And Henry said, "Oh yes, I remember you," and he could remember their address, where they lived, and what was wrong with them. I mean, things that you wouldn't ordinarily associate with a busy surgeon's memory of a given patient.
Well, it was interesting with the combination, because Wycis, if he had not been in Spiegel's company, would have been considered a brilliant man. Mm-hmm. But in comparison with Spiegel, people look at Spiegel as being the brilliant member of the group, but it was really both of them. And Wycis used to refer to Spiegel as the only man he knew with 3 frontal lobes.
Well, the two of them in the operating room, gee, Phil, I have such clear recollection of that. The experience of those two guys in the operating room were unbelievable, because Henry Wycis had to have special scrub suits made for him to fit his 300-pound frame. And Henry ate a lot of kielbasa and garlic and always had these fumes going with him. And in the operating room, and his glasses were always dirty, and his fingers were huge. And he would come to the operating room and give the impression he couldn't conceivably do the job, and yet he was, from a technical point of view, not a bad surgeon.
Yeah, well, I was always amazed at these huge stubby fingers and doing the very delicate things in the operating room. When he was motivated, very often he just let the residents sort of take the lead.
Right, and I remember Phil with Spiegel. Remember, had a little glass room he sat in to run the electronics for the stereotaxis. So we would operate in the main operating room, and Spiegel was in a little glass alcove, and there was an intercom between the two, and Spiegel would tell Wycis what to set on this encephalotome. What was he called? Stereotaxis. Yeah. What the setting was to set, and either you'd set it or I'd set it, or Dick Lehman would set it, or someone like that. And one day, Spiegel said, "Wycis, 2 millimeters more." And Spiegel says, "Don't move it. That old guy doesn't know what the hell he's talking about." And Spiegel must have heard him, because he said, "Wycis, what did you say?" And he said, "Dr. Spiegel, I didn't say anything." He says, "That's very good."
And he always called him Dr. Spiegel.
Oh, yes, very
And
formally.
it was always Dr. Wycis. And it's interesting, too, because even Spiegel's European colleagues who put a lot of importance in the title of professor called him doctor. It was almost as if he was above the title of professor, and that was Dr. Spiegel to everybody.
He was, I think, treated with great respect in all circles that he traveled.
Oh, absolutely.
I remember it was 1962, the World Stereotaxis meeting was held at Temple, and the room was packed. No, it was in 61, I think. The room was packed with prominent neurosurgeons, and I was a young guy. I came just to see the crowd more than to hear the science. And Telerak came and gave a very long paper in French. And there was no simultaneous translation. Spiegel was sitting there listening to the paper and translating the paper. I mean, he could do that too. And after one very long paragraph in French, Telerak turned to Spiegel for a translation. And Spiegel looked at the audience and said, "He didn't say anything." But and everyone would accept that from Spiegel. It's not taken as an insult, just as a matter of fact.
And that was his critical nature.
Yeah.
He also was the only one I know of for sure who spoke Latin and spoke Greek as well, I understand, as well as, of course, French and German and Spanish. And for as many years as he was in the United States, never really got over his very, very strong accent. And it was kind of interesting. I was, at one point, I decided that I was going to practice speaking German with him so I could learn German better. And I never got past the first word because he would correct my pronunciation and then tell me how terrible my accent was. But he'd tell me in this heavily accented English. And everything was all the muscle tonus. And I think his accent actually got maybe even stronger each year rather than weaker.
Well, that was very interesting times with him. Phil, I remember working in the lab, and my assignment was to make cats catatonic. And the criteria for doing that was to be able to make the cats hang between two chairs like a suspension bridge. And I had done all this business and buzzed the cat, and the cat became catatonic, and I put him up there. I was very pleased. I went to get Spiegel to look at my research, so-called research. And Spiegel came in, and I gave the juice to the cat. Nothing happened. I gave the little more juice, and the cat got catatonic, and I put him up on the chair to prove my experiment to Spiegel. And the cat became uncatatonic, and so I gave it more juice, and finally I got mad. I turned it up a little too high, and the cat had a convulsion. And he got over that and ran away. And he ran in another room in the lab and hid behind a radiator. And I'm a little bit, and still am a little bit afraid of cats. I guess not so much now, but I was afraid. The cat was showing his teeth and sneering at me and hissing and swinging his paw, and I thought he was going to hurt me. And I had to get Spiegel to come himself and retrieve my cat. And he handed the cat to me like this. He says, "So-called research."
I think it's, in order to really appreciate that, you have to picture Spiegel's lab. In the letter from Parkinson, he outlines giving Spiegel and Mrs. Spiegel several rooms adjacent to each other, and those were the same rooms that he had when we worked with him 30 years later. And first of all, Spiegel never threw away an anatomical specimen. And the labs had, from floor to ceiling, they had shelves with every single cat brain of every experiment he had ever done. And in the back room, which was really the office, He also had every handwritten note that he had ever made on any of his experiments.
Plus some human.
And also at that time, prior to the time we were there, they were doing the variability studies on human brains. And to do those variability studies, the brain had to be fixed in situ and then removed from the head. So they still had a number of those brains around, many of them sectioned or at least one hemisphere, but they also still had some of the heads around, and there was floating in the jar a human head, just waiting for some variability studies. The place where the actual experiments were conducted was a Faraday cage, which was made from local hardware supplies.
Chicken wire.
With chicken wire, well, chicken wire and screening.
Yeah.
But was really pretty primitively made. And the whole lab was like that. The equipment was just very basic equipment and the least expensive that one could get, but just used tremendously effectively. And each piece of equipment was just used for years, and they nurtured it and maintained it even after better equipment came out. Spiegel had, at best, modest research, financial support for his research, but he really made the most of every penny.
Well, it's interesting, Phil. His laboratory would, if a neuroscientist of his quality today were given a lab like Spiegel had in the 50s and 60s, he'd sneer at it. And yet, in that little dinky lab, which was in fact dinky, he was a candidate 2 times for the Nobel Prize, at least considered for the Nobel. And perhaps in retrospect, he should have gotten it, and maybe still should get it in absentia, because there's no doubt that what he and Wycis did has made a major impact on the surgery of the brain.
Well, he had written over 425 papers, individual articles himself. Plus, he had written several books. He had written a book on the neurology of the eye, ear, nose, and throat, which was his first book on that, which was translated into several languages. And then, of course, the 2 large volumes in stereoencephalography. At the age of 88, he wrote his last book called Guided Brain Operations, where he basically just reviewed what was the current status of stereotactic surgery at that time, particularly from the perspective of his own contributions and experience. And at 88, he was just as sharp as he was when he wrote his first paper.
Phil, we ought to talk a little bit about Henry Wycis and his annex. I think as a resident with Henry Wycis was an experience all by itself, because Henry was routine surgery was something I think Henry did just to allow him to keep an office and be a neurosurgeon and pay the overhead. His real interest was stereotaxy, and some of the things that happened. You couldn't depend on Henry always to show up when he was supposed to show up, and I can remember so clearly in the morning, on a Monday morning, 7:30 in the operating room with a patient of his getting ready to have a laminectomy. Henry wasn't there, but that was nothing new. He would show up half an hour late as a routine. And this morning, just as we were getting ready to put the patient to sleep, he called on the telephone in the operating room, and he spoke, and he said, cancel the case. I said, we can't cancel. The patient's here, and the family's this, that, and the other thing. Everything's ready to go. The anesthesia's ready to be induced. He said, I said to cancel the case. He said, I can't get there. And I said, well, how soon can you be here? He said, well, I won't be there till tomorrow. He said, I'm in Cincinnati. And it was a very typical Henry thing. I remember Dr. Scott told me that he and his wife went to the racetrack in Atlantic City on their anniversary every year for years, and they were in the clubhouse, and Mrs. Scott was looking out in the crowd at the rail as the horses were getting ready to run, and with the binoculars, and she turned to Dr. Scott and she said, who's on call this weekend? And Dr. Scott said, Henry. She said, well, Henry's down there at the rail. or watching the horses run. He didn't take those commitments too seriously.
Well, his showing up later and later actually sometimes turned out to provide the residents with some unexpected good experience. When I was working with him with the stereotactic stuff, as soon as he got the idea that I was interested and started to get the hang of what to do, he would indeed show up later and later, and to the point where he could time it so he would get there just 3 minutes before Spiegel would show up, because Spiegel would show up just for the actual electrode insertion and thereafter. And Wycis always managed to beat Spiegel. He was never later than Spiegel, but sometimes by a hair. But the pre-planning was done at that time with Emery Zekli, and you can't talk about Spiegel and Wycis without talking about Zekli. And Zekli was a Hungarian refugee who was actually a veterinarian. And the word is that he was of the aristocracy and had his own horses, which is why I was interested in becoming a veterinarian. But then when he became a refugee, he became the laboratory assistant in Spiegel's lab for just many years. And he was just an excellent gentleman, just the finest gentleman, and but really was the person, at least the time that we were there, that made the lab run from day to day.
He was very intelligent. He wasn't, of course, as intelligent as Spiegel was, but very few people in the world were, but Emery Zekli was an extremely bright man, and was a major player in the lab.
He was, Spiegel, for all of his ideas, was probably not well enough organized just to keep the lab going on a day-to-day basis, be sure the supplies were there and there were enough cats to do the experiments. But Zekli would handle all of that and make sure all the data was taken care of, and really was a key player in that whole thing. He also would go to the operating room and he'd participate in doing the measurements, the calculations, and so forth. He could actually do the stereotactic surgery as well as anybody if he had the authority to just go ahead and do it himself, but always stayed very politely in the background.
And he was very polite and very, very European in his deference to Spiegel and Wycis, and actually to everyone. He treated the residents with great respect, something we didn't get a whole lot of in those days. And actually, he had a lovely wife who was an EEG technician, so she was part of the operation at that time too, doing her EEG work. Phil, I wanted to go back to Henry Wycis a minute and tell the story about Henry doing a routine neurosurgery. I was operating with him, helping him do a posterior fossa case when he was doing an operation you and I coined to call the Dandy Wycis operation, when he would cut for torticollis, when he would cut all the motor roots, the spinal accessory, C1, 2, 3, and 4 on one side. And as time evolved, it was your job or my job or the resident's job to actually do the operation. So we'd open up, and Henry would sometimes be there, sometimes not be there, sometimes come and sometimes leave. And cutting the roots was not a big deal. We would snip the roots, and his pet thing was the motor root of C1, which is not a consistent finding. And he would always say, did you look for, or did you cut the motor root of C1? And this day in particular, I recall Henry asked me that question. I can say Henry here because he's long gone. I can say that, he won't get mad at me. And he said, did you cut C1? And I said, yes, sir, I cut C1. He said, let me look. And he had those big, thick, dirty glasses. He's fat, and he comes up and looks at me. He said, you missed it. I said, I don't think so. He said to the nurse, give me the Metzenbaum scissors. Mind you, to cut the motor root of C1, or the motor rootlets of C1. And he takes the Metzenbaum and puts them up in the posterior fossa and cut, bang, cripes. He cut Pike in half. So it bleeds a lot, Phil. And it's loose. You see, it's like a garden hose in the yard. It's squirting around like this, and zzz, and of course, in about a 30 seconds, all the arachnoid space was filled up with blood, and it was a mess. I didn't know what was going to happen. And Henry said to me, he always called me by my last name, maybe you too. He always said,
Everybody.
he says, Buchheit, he says, what do you think we ought to do about that? And I said, geez, I don't know, Dr. Weiss. He said, do you think you can see it? He said, I'm having trouble seeing it, Buchheit. Do you think you can see it? I said, I'll try. So he stepped aside, probably with a sigh of relief at that point. And I put we were using those Cushing clips, we called them silver clips. They were just stainless steel clips. And I put one in the head, in the posterior fossa, and I had a sucker, and it was trying to suck out the blood. And for some reason or other, the artery fell into the clip, and my reflexes at a younger age were good enough to get it. I clamped it and clamped the artery, and the bleeding stopped, like some miracle. And I irrigated all the posterior fossa out, and things quieted down, but a little bit nervous about ligating the pica. And Henry turned to me and he said, well, Buchheit, he said, brain surgery takes teamwork, and left. And that was all there was to it.
On the other hand, what he really set his mind to was concentrating on it. He could do fantastic work. You'd mentioned the one case where you complimented Adano doing such a good job, and he said, well, didn't you think I could do it?
Right. It was, Phil, he was sort of a Jekyll and Hyde type of guy. He had two sides to him. One was a very, very, very concerned person, and the other was that he didn't give much of a damn what happened. I know when I was in the hospital as a resident, the only attending that came to see me was Henry Wycis. He came in and sat down in the bed next to me, and we had a nice talk. I was only in a day or so, but I remember the only one that come was Henry. And
well, he had a summer home in New Jersey, in Beach Haven, I think. And several times he had me down there with my family, and the kids who were at that time were between the ages of about 1 and 4 or 5 years. And he was like the gloating grandfather with these kids around. He just loved the kids, and loved to play with them, and just a warm individual.
Henry, I tell you, I think there are a lot of stories one could tell about Henry. I think you'd have to see him maybe and know him a little bit to understand the real value of the story, because the story taken out of context from the man may come across a little unusual. My recollection of Henry was that the world focused on stereotaxic surgery. He was talking about, back in the 60s, talking about biopsy of brain tumors, removal of intracerebral clots, maybe obliteration of aneurysms. And his mind was constantly bubbling through these different uses for stereotaxy, all of which have come to pass now, but which Henry saw clearly in 1960s.
Well, if you look at the literature, particularly in functional neurosurgery, between 1947 and the end of the 1950s, Spiegel and Wycis had done almost everything that's been done since then. But they may have done just 4 of this and 6 of that and 7 of that. But we're clearly ahead of everybody else with the exception of Parkinson's disease. There's an interesting story about that. Maybe we should back up and talk about how they developed stereotactic surgery in the first place, what they wanted to do, or what instigated this whole thing. Spiegel was a neurologist, a clinical neurologist, as well as an experimental neurologist. And he was appalled by prefrontal lobotomy. He was appalled by the idea of going in there and just blindly trying to interrupt the prefrontal tracts. his idea was that you could do that operation much more discreetly if you had an apparatus that could selectively obliterate the dorsal median nucleus of the thalamus and spare all the frontal association fibers and spare the intellect of the patient. And that was really the motivation for the development of stereotactic surgery. Now, Horsley and Clark in 1906 had developed, of course, an animal apparatus. This was based on coordinates that were derived from landmarks for the external auditory canal and the inferior orbital rim, which was the same plane that the anthropologist used as a reference to measure the skull. Well, the first model of Spiegel-Wycis apparatus, if you look at that next to the original Horsley-Clark apparatus, was essentially the same apparatus, except with Horsley and Clark, it was mounted on a frame that held the animal's head, and the first Spiegel-Wycis, it was the same type of electrode carrier, except mounted on a plaster cap that was made individually for each patient, from which a ring was suspended. But when the ring was first on, it was put on with earplugs and little tabs below the eyes, just exactly the way Horsley and Clark had done it, to line up the ring, then put the plaster cast to hold the ring, and then remove these plugs. And the idea was that this would be a more refined technique for psychosurgery, and they were clearly the first ones to do it, and their first publication was in 1947. Within the next 5 years, there were another half dozen reports of different types of stereotactic surgery throughout the world, but they were clearly the first. Even though it was designed for psychosurgery, within a year or two after that, they were starting to use it for movement disorders. The first one was in Huntington's chorea. They treated chorea. They used it not only for dorsal median nucleus, but also for cingulotomies. They used it for pain, for management of pain. They did the first mesencephalotomies. So they did a whole variety of things, and that next 10 or 15 years was probably the most productive period in the development of a new field as there ever was anywhere. And most of the first steps were taken by Spiegel and Wycis, and I think that's generally acknowledged even by the other pioneers in the field who recognized Spiegel and Wycis' contributions, even though it might have been in competition with their own contributions. The one area that they didn't get into initially was in Parkinson's disease. And Spiegel had recognized from the experimental work that animals develop hypokinesia and the paucity of movements if you make lesions in the globus pallidus or the thalamus, where he also recognized it was most likely placed to interrupt the pathways for Parkinson's disease. It wasn't until Cooper had presented his first surgeries with anterior choroidal artery ligation that it became apparent that, yes, you could sacrifice some of these areas without this feared complication. So it wasn't too long after that Spiegel and Wycis got into first doing a pallidotomy, then following the same pathway from the globus pallidus down the ansel lenticularis to Farrell's field and up to the thalamus, interrupting that same pathway at different areas along its way. And in almost every case, they were the ones who first tried the new area of the pathway. There was no such thing as an experimental model of an animal model for any of this. The pathways were known from animal experimentation, but what the effect would be in the human couldn't really be predicted with great accuracy. So it was an era of human experimentation that there was no way to know for sure what was going to happen.
With no IRBs.
And no IRBs, but Spiegel felt very strongly that he had to have in his mind enough assurance from animal experimentation that the probability of success was very high before he would agree to participate.
You know, Phil, I asked Henry one time how he and Wycis arrived at the conclusion that where to make these lesions, and why they changed from here to there. He said, it's all done. He said, you just have to read it.
Oh,
And I said, where would you read it? He said, go get Gray's Anatomy. He said, I'll tell you exactly where to make deletions in Gray's Anatomy. What the point he was making, I thought, to me, was that what they did was know the anatomical substrate of the pathology and make lesions appropriate to that.
well, Spiegel's contention was, of course, as I mentioned before, that there was precedent for everything in the literature, and there was certainly precedent for everything he did, and he could document beautifully the anatomy and the physiology that had gone before, from which he based his conclusion about what to do. And he had the most fantastic ability to put together little pieces of information from here and there and draw the right conclusion. Not only in the operating room, but in the laboratory as well. And sometimes he would explain why he was doing a particular thing in the laboratory based on a little information from here and a little information from there, and this is what he anticipated would happen. And I said, well, gee, it may or may not, but it was uncanny the way he was almost always right about his conclusions. And if it were in the literature, he knew it.
Mm-hmm.
he just seemed to know everything that was in the literature, in whatever language it had been written. We were talking about some of the contrast between Spiegel and Wycis, and I think one of the interesting contrasts was just visiting each of their homes. And Wycis lived out in the main line in this ultra-modern semi-glass house that was really pretty flashy.
In the days I was there, in the 60s, it was very flashy.
And
Totally different than what you'd expect Henry to have.
That's right, and totally different than anything else around
Right,
it.
right.
It was just a decade or so in
It was on
advance of
a thing called Indian Creek Road.
That's
remember
right.
that, Indian Creek Road.
And it was flashy but elegant, and of course housed his many different collections. From issue 1, volume 1 of National Geographic in the study, and also in the same study, he had a collection of movies on every single patient with movement disorder they had ever worked on. Spiegel, on the other hand, lived in an older part of town that was sort of declining, and it was hard to see the house. It was an area where there were separate houses, and they were in lots that were maybe about 100 feet wide. So they were fairly nice lots with lots of vegetation, lots of trees and well-manicured lawns, except for Spiegel's house. And he didn't have a lawn. There was so much vegetation around the house you couldn't see the house. and all of these bushes and everything, I don't think were ever trimmed. They just sort of grew, and it looked almost like a jungle appearance. Then you'd walk into the house. Well, as you'd approach the front door, the last time that I was there was, I think it was shortly before he died, so it must have been in about 1983. And as you knock on the front door, the one thing that strikes your eye is a sticker that they had contributed to the United Way in 1951, and the sticker was still there on the front door. And you walk into the house, and it was like a museum. Although Weiss has collected all these elegant things and had them all nicely cataloged, Spiegel had just books and books and books everywhere. The living room were books, and the only place that he didn't have books, they had museum paintings, museum quality paintings. I understand Mrs. Spiegel's father was the curator of an art museum in Vienna, and a collector of museum quality pieces, which somehow or other they managed to get over to the States. So here was this totally disheveled place that looked like something from 19th century Vienna, with the tasseled doilies and the dark red drapes and just the opposite of what Weiss's house was. And there was a little sitting room. Well, actually, it was a big room, but the sitting area is fairly small because they had books piled on tables all around the room. And invariably, Spiegel would offer wine, little Manischewitz wine and cookies. And we would sit there and the conversation was always scientific, very little social conversation, but always about what was happening in the scientific world and particularly what his thoughts were about the field of neurology and stereotactic surgery. Spiegel's wife was older than he by a couple of years, and she had a stroke about 5 years before she died. And I think one of the saddest remembrances I had of Spiegel was visiting him. She already had the stroke several years before, and she was living at home with her sister, Helen Adolf, and Dr. Spiegel, and the two of them were taking care of her at home, even though other families probably would have had her in a nursing home. And my wife and I were there, and we had lunch with them. And the lunch was, we started to go into lunch, and then everything paused for maybe about 15 minutes while Mrs. Spiegel laboriously came in from the other room to sit with everybody at the lunch table. And he just was totally devoted to her care. And this little old Viennese couple, and he would not do anything or even say anything until she was in from the other room and seated at the table. And she required help in eating, and she couldn't really talk and participate in the conversation. But he made sure that she was well taken care of during this whole time we were having lunch. She died about a year later, and within a few months after that, he died. He went into just a profound depression when she died, and that was the final event in his life.
Phil, perhaps the most poignant part of my dealings with Spiegel, and Weiss's for that matter, was their funerals. I think there was some, Henry's, you and I went to Henry's funeral when he died. What year would he die? In 71. 71. He died, and he was being buried from a funeral home in southwestern Philadelphia. I forget the name of the district, but it was a blue-collar district, and I don't know how they ever picked this funeral home. And I remember you and I think I picked you up at the airport.
Yeah, I was coming in from Cleveland.
Right.
And you picked me up at the airport.
And we went over to this funeral home, and in this neighborhood, and no one was there. Maybe you could tell the story better than I can, because it seems so funny to me.
Well, it was unusual. And we go to this funeral home, which was on the street. Neither one of us really knew what funeral home, and we had the approximate address. And we walked in, nobody's there, and there's nothing there but a closed casket in the middle of the room. It was sort of a dingy place. And I remember one of us making the comment that Henry wouldn't be caught dead in a place like that. And sure enough, he wasn't, because it turned out to be the wrong funeral home.
Right. That was the funny part. We went there and sat around, must have sat around for 20, 30 minutes, this casket, and no people. What the heck's going on? And I don't know how we found out it was the wrong place. Then we went to the right place. Remember that?
That's right.
And there were a lot of people there. And the casket was closed, a lot of nice flowers. And Henry, as I came up to speak to his wife, you and I were together, and I think both of us agreed that Henry probably wasn't in the casket. He was enough of a rascal to have probably taken the money gone to South America, and either hired some guy to lay in there or had them put some rocks so they think it was full. We thought the casket was a little bit small for Henry.
That's right, and that would not have been beyond him, I think. And interestingly, also that most of the people who were there at the funeral were not medical people. There were very few people from the surgical community, but there were judges and lawyers and politicians and just sort of interesting group of people.
But when Spiegel died, remember you and I went to that too together. You and I, matter of fact, you and I were the two pallbearers. There were 4 or 6 people pallbearers. You and I were 2 of them, and we went to the gravesite at the old northeast Philadelphia Jewish cemetery. On was it March or what month? March or February?
Sometime in the raw spring.
Yeah,
weather.
it was very cold and windy, and a little bit of rain, a little bit of snow in this old Jewish cemetery. But it was so sad. You and I were the only medical people there again. And it was interesting to me that in his heyday, the world's most famous neurobiologist, and a household word in every neurosurgeon's office or home, was being buried, and no one was there except you and me. It's sic transit gloria mundi.
Well, that brings to mind, of course, the sad manner in which Spiegel retired. And we talked about how he was hired by Parkinson and really given carte blanche to do what he wanted to do as far as research is concerned. And after the age of 65, it was necessary that each year was an annual appointment at the discretion of the dean. This had continued for another 6 years. At that time, he had NIH grant support and was extremely productive, and really probably probably even more productive then than he had been earlier. And the dean was renewing his contract each year. And there was another faculty member who reached the age of 65.
You might say that there was a new dean. It wasn't.
It
Dr.
wasn't Parkinson. No, it was
no.
another dean who will remain nameless, who was approached by this other faculty member who had not been productive in years, insisting that he be carried on a year-to-year basis also. And his only argument for why he should be carried on is because Spiegel had done it, so he should do it too. And the dean's response was, okay, then Spiegel has to retire. And right in the middle of the academic year, he told me he wasn't going to renew his contract at the end of the year and that he'd have to find somebody else. And Zeckley then became the principal investigator for the duration of the NIH grant. And Spiegel was out, just basically arbitrarily.
But it's kind of sad, though, that if you look back on it, Phil, the same type of thing happened to him in Austria, in Vienna. Mm-hmm. And when he had to leave what he was doing, in the same at Temple, the dean made him leave during a very productive period. It's kind of sad for, without a doubt, the most prominent guy in his field alive at the time.
And afterward, after that, he became unproductive the first few years, but then he was still editing the journal, and he was still writing. And about that time, or shortly after that, is when he passed over the journal editorship to me. And he was doing an annual volume in Progress in Neurology and Psychiatry, which was reviews of the literature written by individual authorities in each area of neuroscience. He stopped doing that and was just withdrawn and very depressed for several years. Then he started becoming active again. He started writing and doing more things. But then he developed colitis, and he was in the hospital, and he convinced himself that he didn't really have colitis, he had cancer. and that the doctors weren't telling him the truth. And again, he became very depressed. And for about 2 years was very withdrawn, and 2 years went by and he hadn't died, and he figured that maybe the doctors were right. And then again, he became very productive and wrote another book after that, as well as a number of other contributions. When he was, I guess he must have been in his late 70s, the World Society for Stereotactic and Functional Neurosurgery met in Zurich. And there was an idea that they would like to have Dr. Spiegel address the group, but at that time he wasn't traveling. And they decided to set up this transatlantic telephone connection into the public address system at the auditorium so Spiegel could welcome the participants at the ceremony. And they patched this through, and Spiegel started to talk. But instead of welcoming the participants, he gave a scientific paper for 20 minutes. And it was based not on laboratory work, but it was based on new conclusions that he drew from review of the literature, and presented an excellent talk, which was then published with the proceedings of the meeting, much to the chagrin of the society, who had to pay the transatlantic telephone bill. Oh dear. Also, the society, we have to mention about the society, because Spiegel and Wycis started the society. You had mentioned already that there was a meeting at Temple, and this was just the first of a number of meetings. And initially, there were annual meetings in the Philadelphia area. And we have to talk about the society, since Spiegel and Wycis were really the moving forces in the development of the Stereotactic Society. You had already mentioned how there was a meeting at Temple in the early 1960s. And this became then the first of a number of meetings, which were at first annually and then every couple of years. And toward the, I think it was probably 1967, there was a decision to formalize things. And they formed the International Society for Research in Stereoencephalography, is the official title. And they formed the American branch of the International Society. And Spiegel and Wycis pretty much ran the society, not only in the United States, but the international group as well. Spiegel being the first president, and Wycis being the secretary, treasurer in perpetuity up until the time of his death. This later, in 1973, was changed to the World Society for Stereotactic and Functional Neurosurgery. Then the different continental societies became the American Society, the European, and the Japanese Society for Stereotactic and Functional Neurosurgery. But the society was indeed not only started by Spiegel and Wycis, but while they were alive and active, they ran the society mainly from Henry's hip pocket. And he kept all the society records on...
and the money, probably.
And the money on just little file cards. And when he died, we couldn't find most of the records. And we pieced together what we could of the membership list from his file cards. But things were just run totally informally. And most of the records they kept in their head. And when he wasn't available, either were the records. Also, I think we have to mention that Henry was really pretty ill the last couple of years of his life. And not only was he obese, you had mentioned 300 pounds, but I think 400 was probably a little closer to what it really was.
I know, Phil, when he was we were there with him, he got sick one time, and I don't know how much he weighed, but I know they had to take him down to the dietary department to put him on the meat scale.
That's right. And he admitted to weighing 365 pounds, but I think he was shaving a few pounds off when he admitted that. But he was diabetic, but
it didn't stop him from eating candy.
He just didn't take care of himself at all. And we would walk into a patient's room, and the patient would hold up a box of candy and say, "Would you like a piece of candy, Dr. Wycis?" And he'd say, "Thanks," and then he'd take the whole box, and by the time we left the room, he'd finished the box of candy.
Yeah. He used to buy those big Hershey candy bars at in the gift shop at the hospital. I mean, no one would eat one. Maybe 2 kids or 3 kids could split one. Not for Henry. Henry, whole thing he himself.
He became very ill. We were at a meeting in, I think that was a meeting in Copenhagen, and he became really very ill at that time, and developed tremendous edema and probably congestive heart failure, and really great difficulties in transporting him home from the meeting. And
Really?
went into the hospital after that. And then a few weeks later, he was, bouncing back and into the candy box again.
You remember when he was operated on, had the lipectomy? He went down to Northeastern Hospital, and Dr. Large, was it Large or John Meinhardt, did a lipectomy on him. Did a big abdominal incision, took out a lot of fat.
Which he put right back
Yeah,
on
he
very
looked great.
quickly.
He looked great for about 2 weeks, and then zing, right back again.
Yeah, we were talking before about his collecting things, and one of the things he collected was gold coins, and that was in the days when Americans could not, maybe I shouldn't say this on tape, but at any rate, it was in the days when Americans couldn't legally import gold or gold coins. But every time he went out of the country, which was fairly frequently because he attended a number of international meetings, he would come back into the country with his shoes filled with gold coins, and had just an amazing collection among his other collection.
Well, in some of the anecdotes that I think about, I mean, I shouldn't give the impression that Henry was always doing something crazy and, funny and sort of devious. This is certainly not the case, but as time goes on, you remember he gets blank for other things, and you remember the colorful issues about him. And I remember he went to Scandinavia one time when I was there. He had come home, and about a week later, a package came for me in the mailroom. So I went and got the package, and I opened it up. Here was a gift from Dr. Wycis. It was a beautiful Scandinavian cheese board with a glass pitcher top to put over top of the cheese, and a nice knife, and it was just lovely. Of course, I was a bachelor living in the resident quarters, so there wasn't much use for it, but that was lovely anyhow. So I picked it up. I went to the phone, and I called Dr. Weiss. I said, "Thank you so much. I got this lovely cheese board gift you sent me from Copenhagen." He said, "Buchheit," he said, "bring it over to the office." So his office was right close here. So I went to the office, and he said, "Let me see it." And he reached up and grabbed it. I took it like this, and he took it away from me. He said, "This is not for you." He said, "I just sent it to you to avoid the taxes." He said, "It's for someone else." It didn't bother him a bit. One time he borrowed $20 from me as a resident. That was a big loan. It was out on the street in front of the hospital. He had to go downtown. He didn't have any money, and he said, "Could you loan me 20? And I don't know where I got 20. I gave him 20. About a week later, he didn't get it back. And I told Dr. Scott, I said, "Geez, Dr. Scott," I said, "Dr. Wycis has $20. It's like someone borrowed $5,000 from you now." I said, "I don't have the money." So he called in, and he said, "Will you pay him back, please, the money?" Scotty got mad as hell about that.
Well, Wycis was, the things you remember are the colorful things about him, because he was really a colorful character. And Spiegel was colorful in just the opposite way.
But I think that everyone had so much respect for Spiegel that everything he did was something we looked at. I remember he was in the neurosurgical conference one day, and we were talking about a neurological problem. Everyone banded it back and forth, neurosurgeons, neurologists, and no one could be sure what it was. Spiegel was sitting there, and he said to the group, he said, "It's very simple." He said, "The patient has a lesion in the right inferior cerebellar peduncle." This was before CAT scanning, MR, anything. It was a hopeless clinical diagnosis to make to substantiate radiographically. At any rate, the patient died, and we practically broke the door down in the morgue to go see the autopsy and see what was going on. And by gosh, the patient had a lesion exactly where Spiegel said it was. And, he was a folk hero, I think, for doing that. To be able to make a diagnosis in an area that no one even knew what its function was.
And at during a large part of the time, particularly the latter part of the time, when they had cut back on the amount of stereotactic surgery they did when Wycis was ill and back and forth to practice, that he earned his extra money by doing insurance physicals and by doing neurological evaluations for insurance companies, which is such a tremendous waste of such an intellect.
There was such a dichotomy of personalities between the two. It's, as we've talked about this, and we've in the recent weeks talking together about doing this today, you know, the memories become so fresh in your mind. They were so dramatic for young people to see this extremely intelligent man doing something that almost no one in the world understood, with another guy who was very bright, who was as much of a maverick as the other guy, the first guy was straight. It was a very interesting experience to have had.
I think that brings us back to the concept of Don Quixote.
Yeah.
Spiegel had written early on, his first book was on the neurology of the eye, ear, nose, and throat, which was translated into several languages. I have a copy of the fellows who went through his laboratory through the years. And for some reason or other, Bill, your name's not on here. I think he disowned you somewhere along the line.
I think I know why it wasn't on there.
But,
you know, that was interesting, Phil, you say that, because I think, I've often thought at his funeral, his best student and his worst student were his pallbearers. I think there's a poignant thing. Probably Spiegel figured that out himself.
well, some of the people who are on here are kind of interesting. Here's Scala from Washington, Oppenheimer, who was the head of physiology at Temple for many years, and in fact, who was the one who originally introduced me to Spiegel. And of course, Henry Wycis, he mentions the years they were there, and this list stops in 1966, but he mentions Wycis since 1938. So when Wycis started working with him as a medical student. Marx in 1945. Marx, of course, was a co-author on that original paper. Spiegel, Weiss,
He was a cardiologist, wasn't he?
Marx and Lee. No, this is M. Marx.
Yeah,
I don't know.
yeah,
I don't know who he was, but he was in 1945, and that's when they actually developed the apparatus. He became a co-investigator. Fried is Umlauf. Henry Baird, pediatric neurologist in Philadelphia. And Henry Baird was then the recipient of Spiegel's library after Spiegel's death. And Baird turned around and donated the entire library to the College of Physicians in Philadelphia, who now has the Spiegel collection of not only his books but also papers of some historical interest. Ben Guidetti from Rome, 1950. Victor Reyes from Manila, 1950. Emery Zekeli since 1952. Chavez, Lima, Peru, 1956. John Adams, Philadelphia, 56. And I start here also in 56. Alexander, Philadelphia, and Boston, 58. Spector, 1958. Number of the residents who went through. Here's Herb Silverstein, who is now prominent in ENT. Flanagan, Burlington Menards, 61. Markham from Indonesia in 64. Escobedo from Mexico City in 65. So there were quite a few people who went through his lab just very, very briefly and were influenced significantly by him. Seeing Oppenheimer's name on the list reminds me of how I first got involved with Spiegel and Wycis. As a freshman medical student, I was looking for a summer research project. And wanted to do something in neurophysiology. Went to Oppenheimer, who was the head of physiology, who told me that they really didn't have a full-fledged neurophysiologist there, but why don't I go down to the hall and see if maybe Dr. Spiegel had anything that I would be interested in. And I wandered down the hall and knocked on the door of the lab and was totally ignored. Come in, and then I walked in and totally ignored. And Spiegel and Wycis were sitting there, and they had their little home projector, little 8mm projector, and they were looking at movies of patients before and after movies, trying to put together a sequence for a talk. And they were so absolutely involved in what they were doing that they were totally oblivious to anything else that was going on, and I was there, and Zeckley was there. So I had nothing to do but just sort of sit there for half an hour until they were through what they were doing momentarily so that they could talk. But by the end of the half an hour, it was such an intense and exciting place to be that right then and there I asked Spiegel whether I could come for the summer. And he indicated, well, they might have something to do. Never really yes or no, but just sort of, well, if you want to come over and see what's here, you can come over and see what's here. But then finally, when it came down to making it official, he did so. So that's how I got involved with them in the first place. And he did indeed keep me very busy once I started. He was, as you know, very demanding. That what he wanted done in the laboratory had to be done now.
And the way he wanted it.
And the way he wanted,
Yeah,
absolutely the way he wanted it. There was no room for maneuvering. Interestingly, though, the first project he gave me was to compare different ways of making lesions in the brain. Compare the electrolytic method, which he was using in the direct current, and compare radio frequency and comparing injection of alcohol. But at that time, I didn't know it, but there was the controversy, what's the best way to make the lesion? And some people were using alcohol injections, and there was some controversy, does it spread, and so forth. But Spiegel instructed me not to read anything about it until after I had drawn my own conclusions. And I took cats and made lesions one way, the other way, and put some stain in the alcohol so we could tell how it was diffusing through the brain, and then came up with the conclusion that alcohol diffused all over the place, and the electrolytic lesion was the most discrete lesion, because at that time the radio frequency generators made very erratic lesions. It turned out to have reinforced exactly what his contention was, but he made sure that I didn't bias myself by knowing that in advance of doing the experiment.
Curious thing.
But also the other thing is that when getting involved with some of the physiologic experiments and sometimes doing some very subtle things, he wouldn't explain it for me. He'd tell me where I could read it, and he would tell me where I could get the background for it, but insisted that I search it out myself. Then we'd talk about it, and then he would explain why he was doing what he was doing. So even though he communicated very sparsely, and at that time, there was not a personal word exchanged in the laboratory, I recognize now what I didn't recognize then, that the manner in that he was presenting it was the best teaching exercise that would be possible.
Well, it's the Socratic method, the old European method of learning. No lectures, just go to school.
That's right. And dig it out for yourself. When you know enough about it to discuss it, then we'll discuss it. And he was just great. And he repeatedly showed me the errors of my conclusions, and invariably he was right. And invariably also, he knew something he hadn't disclosed that would affect his argument. Spiegel and Wycis were the first ones to do single cell recording in the human, I remember we spent, just days and days polishing stainless steel electrodes electrolytically, bringing them down to a point and making them in the laboratory and then going over to the operating room. And of course, in those days, there was an awfully noisy electrical environment in the operating room, but shielding the patient and getting the individual recordings. And we had done that in perhaps half a dozen patients who were coming in for thalamotomy or campotomy at that time. But Spiegel didn't see any information that he thought was physiologically interesting. We were getting random recordings, and yes, we could identify single units. And I don't think he ever published it just because it wasn't physiologically interesting, even though he was the first one to do it, and then other people started doing it.
But Phil, I remember very clearly being in the operating room with him, and we recorded single cell potentials from the midbrain, human midbrain.
Oh, yes.
And he had that, what was it, a computer of average transients? He had
that was
box.
afterwards. That's
Right.
right. And then he.
But there was no institutional review boards on this stuff. We just did it. We were there for another reason. Recorded those cell potential. It was very exciting in the operating room that day. I remember Spiegel and Wycis both very excited. Well, everyone was. It was the first time a human being.
And after that, especially after they got the computer of average transients, which was an averager, then they started to report single unit recordings. But by then, other people had already picked it up and started doing single unit recordings. But they did it just as a matter of course. This is the next step. This is what you do. That computer of average transients was kind of interesting because it was a $10,000 computer that sat on the desk, and it had probably about as much computer power as my digital watch. And all it did was just to
Average out the noise.
Average out the noise. But it made it possible to do things like midbrain recording.
Phil, let me ask you one question. What do you think Spiegel and Wycis would be able to do today with computers and CAT scanners and MR scanners? Would it be interesting to fantasize about how their world would be now?
Well, I don't think that it really would have changed too much of what they did, because the things they did were based more on physiologic information and drawing conclusions from what was in the literature. Now, the literature is much more voluminous now, but not necessarily with more information that would influence what they were doing. So it wasn't the fancy hardware or imaging techniques that would have made the difference. It was the concepts which they had, and I think they would have, although drawing from a larger database, evolved the same type of concepts rather than getting involved with razzle dazzle. But to balance that out, I think with the present concerns about human experimentation, that the field of stereotactic surgery probably never would have developed, or would certainly have developed only with great difficulty if the attitudes were the same then as they are now. Because at one point, there was nothing more that could be done in the laboratory before taking the patient to the operating room and interrupting the pathway. And they informed the patients that this was something new. And I think the patients expected it because they were going to Mecca to have it done.
But I was going to say that to you. I think that they went to great lengths to explain to the patients that they were doing something, they were on the frontiers of doing things, and that they're going to try something on them to see if it worked. And the patients that they did it on were so desperate they were willing to let them do it.
Well, that's right, but I don't know whether they could have gotten some of these things through a present
No,
day
I don't think so.
And I think it would have been an uphill battle to try to do some of these things for the first time.
And the other thing too, Phil, that I think that both Spiegel and Wycis pushed the edge on what the patient was expecting to do. They would just go edge up a little bit more on it and really get the maximum amount out of everything. Every case was an experiment to those guys.
Oh, absolutely.
It was not there was no such thing as an operation. It was an experiment.
And every time there was an electrode in the brain was the opportunity
Right.
to get new information.
Right. You just didn't. You put the electrode in, make the lesion, but do some other things on the way in and the way out.
And while the electrode is there, that's your chance to
Yeah,
record or
right,
to stimulate or do
right.
something further. And they took full advantage of it, and that's what made the next operation that much better or that much...
You know, it's interesting, Phil, as we talk about this now, I don't have a recollection of anything bad happening because of what they were doing. Do you know of any patient I'm sure there were patients that had side effects of it, but it was not an ongoing thing. Their complication rate was fairly low.
The only complication I remember of significance was a patient who died. Had nothing to do with the stereotaxis. It was a patient who had an air embolism.
Mm-hmm.
And it was an older patient. They worked, of course, in the sitting position so they could get the x-rays. The patient, under local anesthesia, had an air embolism. Went into status asthmaticus, didn't die of the air embolism, died of asthma. And it turned out that the patient had withheld information about his past medical history because he was so desperate to have the surgery. But that was the only significant complication I remember in all those cases.